Okay, I'm ready to start my checkoff. The first thing I would do is check my physician's orders, check for any type of reason that we would not be able to insert an NG tube, such as surgery or inflammation, deviated septum, anything like that. And then I'm going to check to make sure I have an order to insert my NG tube. And I do. Order number 1 states insert NG for feeding and medications. And order number 2, administer 30 mLs of Ensure via the NG now. And I also have an order for acetaminophen, 325 milligrams NG now for pain. And my patient is Harold Marks. So it looks like everything is in order there. I will gather my box of supplies and go to my bedside. Hello, Mr. Marks. It's Katie, your student nurse. How are you doing? Still in some pain from earlier? All right, well, I do have some medicine with me, and we're going to try to take care of that. I do need to tell you that the doctor wants to put a tube in your nose. I'm not sure if he talked to you about that. The purpose of that is going to be so that we can put medication and also some of your formula feeding down that tube and into your stomach. If you have any questions along the way, just let me know. If you don't mind, I'm going to move your table a little bit so that I can set up everything I need. Oh, one other thing. Let me just verify your bracelet with my order. Harold Marks, 1235, 1235. All right, looks like we're good to go there. I'm going to raise your bed a little bit so that it's easier for me to reach you. Alright, that should be good. And I know that the head of your bed is already up. Are you in a comfortable position? I would like for you to be sitting kind of the way that you are. Okay, great. I'm just going to take a minute to set up all my supplies. I'm going to have you hold the tissues and this basin just in case of emergency. All right, and are you having any stomach pain, discomfort, gas, anything like that? All right, do you mind if I just feel gently on your stomach before we begin? Okay. Now, of course, if Mr. Marks were on isolation, I would have also put on any required isolation garb. All right, like I said, I'm just going to feel gently on your stomach. Any pain or tenderness? No? Good. And I listened to your belly with my stethoscope this morning, and everything sounded great. So the first thing I'm going to do is measure to see how far I'll need to put this tube into your nose. Okay. And one other question before I go any further. Do you have any problems breathing out of either side of your nose, or have you had any nose surgery in the past? All right. I'm just going to take a look there. Looks clear on both sides. If you don't mind, I'll just go ahead and put it in here on the right side, since that's the side I'm standing on. One thing I do ask of you is, with your cup of water, when I let you know, could you take a few sips? And that will help me put the tube down easier and also make it easier on you. All right. Ready? 1, 2, 3. All right, go ahead and take some drinks of that water. Doing well, keep it up. Great job. And before I tape it down, I'm just going to make sure it's in the right location. No trouble breathing, do you? All right. All right. Looks like we're in the right place. I'm going to put some protectant on your nose. That will help the tape stick less to your skin, but still remain in place. It will also help it come off easier. Now, I don't want the tube to be too tight against your nose, so let me know if it feels like it's pulling against the top of your nose. And let me check your orders again to make sure you don't need a chest X-ray. All right, looks like we're good with just what I've done so far. All right. So now I am going to just measure so that I can document later for other nurses to know how much of that tube should be coming out of your nose. I'll try not to pull. Looks like 54 centimeters. Okay, the next thing that I'm going to do is go ahead and give you some formula through your tube. And let's see. Looks like you'll be getting Ensure. And here we have Ensure, and I'm checking the expiration date, and good news, it's not expired. I also have some water I'm going to use, and that's to make sure that the tube stays clear as we're going. I'm going to use a syringe to see if there's anything left in your belly from the last time you ate. Just a drip, that's great. Okay. Oh, you know what I forgot? I never put this on top of you. I'm going to go ahead and do it now, just in case there's any leaking when I put the tube feeding in or the water. Sorry about that. All right, so first I'm going to put an ounce of water. And we'll let that go in. Then I'm going to put 1 ounce of Ensure, which is what the doctor ordered you to have. And then another ounce of water just to clear out the tube. All right, how's your belly feeling? I want to make sure you don't feel nauseous or too full or anything like that. Good. All right, next I'm going to get your medicine ready, and it'll just take me a minute. We're lucky to have the medications delivered to the bedside in this hospital. A lot of places don't have that luxury. All right, so psych, you're going to hear me say a lot of different things, but I'm just double checking to make sure we have everything right. So we have Harold Marks 1,2,35, acetaminophen 325 milligrams via NG now for pain. Acetaminophen 325 milligrams. Great. I'm just crushing the tablet so that it goes down your tube easier. All right. And I'm going to mix it with a little water. And let's just double check again. Acetaminophen, 325 milligrams via NG now for pain for Harold Marks 1,2,35. All right. Everything's going well. And I just want to check your bracelet one last time. Harold Marks 1,2,35. Harold Marks 1,2,35. And acetaminophen 325 milligrams. NG now for pain. And it looks like this is the first time you've gotten Tylenol since you've been here. Is that right? All right. And no allergies to Tylenol? Great. All right. We're on the home stretch, Mr. Marks. Since I already cleared the tube out the last time when we did the feeding, I won't do another 30 or 1 ounce now. I'm going to go ahead and just give you the medicine. And a little water to flush that down. Still feeling all right? Great. Okay. Now, I don't want your tube to pull on your gown at all, so I'm just going to use a safety pin to pin it to your gown. If you look at this blue part here, we want that really to stay above your stomach, so anytime you get up, this should be pinned to the top of your gown. All right, and if you don't mind, I'm going to leave you sitting up a little bit so that that feed we just gave you in your stomach isn't making your stomach too uncomfortable or making you have some reflux by laying down. All right, great. So you have your water and you still have your colite. That's good. I'm going to put your bed down. I'll set your water back here where I found it. Colite, bed. You said you're comfortable. I'll come back in about 30 minutes to an hour if I don't hear from you before that, just to make sure that that Tylenol is working for your pain. And anything else you can think of? All right. Well, let me know if you need anything. Oh, by the way, do you want me to leave your door open or closed? All right, great. I'll come back in and check on you. All right, and then I would document my procedure. So he tolerated all of the procedure very well. There was no issue with the tube feeding. I inserted a 14 French Salem sump NG tube. I got no gastric residual. There are 54 centimeters remaining from nair to the end of the NG tube. His pain is a 4 out of 10. I gave the Tylenol and I'll reassess in about half an hour.